Thank you, Mr. Chair and members of the committee. For the record, my name is Josh Berg, and I am thrilled to be here again today, this time alongside my colleague, Mr. Mark Cullen, to discuss Senate File 554. Mr. Cullen will delve into the specifics of the bill, and I will keep my introductory remarks brief. My journey with Trellis and Juniper began several years ago when I joined their Community Advisory Committee, and I've had the privilege of joining the Trellis and Juniper Board of Directors a smidge over 2 years ago. Since then, Mr. Chair and members, I have been profoundly impressed by the transformative work these teams have undertaken to revolutionize our approach to supporting older adults in their communities across Minnesota. This transformation is driven by the comprehensive, collective, and coordinated passion, wisdom, and mission of hundreds of community-based organizations across the state. Today, we will provide an overview of the work that has been going on for nearly a decade and share our vision for the future. In previous legislative sessions, and particularly in the current one, there has been significant discussion about finding innovative, effective, and scalable ways to better serve Minnesotans. Our goal is to achieve this in a more cost-effective manner that addresses the unsustainable cost curve our system faces in the coming years. Senator McQuaid, this is not just another cute PowerPoint presentation. In fact, there is no PowerPoint presentation at all. This is a game changer that we believe will serve as a catalyst for other innovative ideas and solutions, positioning Minnesota as a leader in innovation once again. We are committed to collaborating with state agencies, MMB, the LBO, and all of you to create dynamic forecasts that demonstrate how this investment will lead to future ongoing and substantial cost savings. These savings will not only offset the initial expense, but will also reduce the deficit in our out years and in the long tails. With that, Mr. Chair, I will now turn it over to Mr. Cullen to provide more details about the Community Care Hub, and we look forward to addressing any questions you might have.
Thank you, Mr. Berg, for the comprehensive, coordinated, and collaborative statements there regarding Mr. Cullen. I appreciate that. Was good. I'm not going to perseverate on those 3 words, by the way. So, Mr. Cullen.
All right, I'm not used to being called Mr. Cullen. That was my dad. All right, good afternoon. I'm Mark Cullen, Vice President of Strategy and Business Development at Trellis, a community-based organization that provides services, connections, and innovations to help people thrive as they age. And today, I'm here to describe an innovative approach to solving our collective budget challenges while increasing investment in community-based services like food, housing, and chore services directed to people who can most benefit. Now, these social supports, when delivered as a part of a healthcare episode, such as a hospitalization, frequent emergency room visits, or integrated into a care plan following a disease diagnosis, can unlock new value and produce savings for organizations like the state of Minnesota that bear financial risk for the growing cost of healthcare. Now, before I describe our solution, I found it helpful to start by focusing on the people that this effort is designed to support. When I speak to groups about this work, I often begin by asking for a show of hands to illustrate the widespread experience of caregiving. I ask attendees to raise their hands if they've been deeply involved in caring for a parent, a spouse, a child, or a family member. And without fail, nearly every hand in the room goes up, probably no surprise to you. And then maybe you're thinking about your own experiences now. Then I ask the audience to keep their hands raised if that experience involved navigating the healthcare system in situations where social support could have made a difference. Again, nearly every hand remains raised. And the point, of course, is that this moment creates a moment of shared understanding. It helps us to understand that the problems and the challenges that we find in our system are deeply personal for people. We heard that as we were getting started today. The reality is that needing help isn't a question of if, it's a question of when. Now, I grew up in a really small community, 600 people, and I've been to enough pancake breakfasts and Whopper feeds to know that one bad day or a serious diagnosis can change a life forever. Other states have recognized this challenge and are taking action. State governments are building public-private partnerships to bridge the gap between healthcare and social services, helping people navigate these complex systems more effectively by capitalizing the infrastructure necessary to enable service delivery, while also addressing policy barriers that can limit the inclusion of social services in a patient's care plan. We have closely tracked integration efforts in other states, where early studies show meaningful cost savings for state governments and healthcare organizations. For example, in North Carolina, where they have a pilot closely aligned with our vision for Minnesota, they're showing a savings of $85 per person per month in their Medicaid program. So here's the number, right? So if we applied the same savings calculation to the approximately 124,000 older Minnesotans enrolled this month in the elderly and special needs products, we would see $126,480,000 in savings this year alone.
Do you want to say that again?
Yeah, all right, so 124,000 Minnesotans are enrolled in elderly and special needs products in this month.
Yep.
At $85 per person per month, as they're seeing in North Carolina, that creates a savings of $126,480,000. And so what they're seeing is reduced hospitalizations and emergency department use for people that are going there because they're hungry and because they're homeless, right? So that's where the savings are. Expanding beyond older people would yield even more savings. In 2017, we began testing our proof of concept, now called a community care hub. This hub that we call Juniper aggregates social service organizations into a provider network, aligns their services toward healthcare providers, and then measures the savings. Juniper collaborates with community-based organizations all across the state in order to deliver these services. So let's look at falls as just one example of the power that this kind of model can have. So today, falls cost Minnesota $700 million annually. Those are in the budgets of the state government and the budgets of Minnesota families. For many of us, a fall is the first indication that something may be changing with a loved one. If we're fortunate, the initial fall doesn't cause an injury. However, a first fall often increases the risk of future falls in older adults. And that first injurious fall can trigger a series of events, often escalating to the need for assisted living and skilled nursing care. As families exhaust their financial resources, the state of Minnesota ultimately becomes the primary payer for many individuals, placing significant strain on the budgets like we talked about at the start of today. Now, the Kaiser Family Foundation reports that today in Minnesota, older people and people with disabilities make up 16% of Medicaid enrollees, but they account for 57% of the total expenditures. But more than that, these people are our mothers. They're our grandparents. They're our children. They are our neighbors who deserve our love and our commitment to innovation and good public policy that makes financial sense. These things can and do go together. The good news is that many social drivers of health are addressable, and many are even preventable by addressing key social and environmental risk factors. For example, research shows that 30 to 50% of falls among older adults are linked to modifiable risk factors such as inadequate lighting, unsafe home environments, lack of social engagement, and limited access to preventative health care and physical activity programs. Interventions that improve home safety, increase physical activity, ensure access to vision care, and enhance social support networks can significantly reduce fall risk and help older adults maintain their independence. Now our hub's targeted interventions like fall prevention programs have served over 30,000 Minnesotans since we began, demonstrating significant cost savings and health benefits. Our proof of concept has had an impressive impact. In 2024, 1,850 Minnesotans completed our fall prevention programs delivered by community-based organizations all across our states and in your districts. That work saved us $8.4 million in 2024 alone. That's a 300% return on investment after accounting for the cost of paying the community-based organizations to do the programs and covering the cost of the hub's operation. By expanding these services to include additional support like home modifications, chore services, and food delivery, we can lead the way in caring for our neighbors. Now, the good news is that you've provided public support, and I'm sure some of your own charitable dollars to fund these services in communities across our state. What's missing is a strategy around prevention and a related measurement of the business drivers and cost savings that we can attribute to these supports. So here's the solution. Senate File 554 seeks an infusion of $9.9 million to expand Minnesota's community care hub infrastructure. This investment is supported by 59 organizations from all across the state, and it'll help improve the hub's capabilities to enable more personalized services for people experiencing illness or injury. The investment is scalable. and allows the hub to centralize administrative capabilities like data analysis, shared technology platforms, compliance programs and program audits, contracting, maintaining credentialing, accounting and billing services, staff and partner training, and other infrastructure needs that are too expensive to carry at the community-based level in the thousands of nonprofits in our state. Our hub works closely with healthcare providers who share our vision for better managing the cost of care, allowing for a deeper understanding of how our public investments can generate valuable returns on investment. The state of Minnesota has a compelling reason to make this investment. This Own Your Future report, commissioned by the Department of Human Services, cites future costs for long-term care that are expected to grow by 70% over the next 10 years, totaling $1.5 billion. The report specifically cites the importance of home and community-based services offered through a centralized structure as a solution for lowering the costs found in these projections. If these social services produce financial value as measured by cost savings or improved quality metrics, then we should consider ways to scale that impact. If financial value is not found, then we should invest in the health of our community in other ways. We can view these social services as the right and moral thing to do for our neighbors and expect that the services make good business sense at the same time. We can't forget that the experience of aging and the experience of receiving healthcare services is deeply personal. When we share our vision for Juniper, people often think about their own experiences, just as you did a moment ago. We've never been better positioned to support our loved ones across the aging journey by modernizing the support that can best fit their situation when that support can have the most impact from the day a healthcare condition first comes to the surface to the day we say our final goodbyes. By making services more available when they are most needed, we can all have a better quality of life as we age while preserving resources for future generations. Thank you for your time and consideration, and I'm happy to answer your questions.
Members? Senator Utke, anybody? Gruenhagen, Josh? Senator Gruenhagen?
Thank you, Mr. Chair. Yeah, thanks for your testimony. Was it North Carolina or South Carolina?
North Carolina.
North Carolina. How long has that program been in force?
Mr. Cullen?
Oh boy, so it's I think it's a couple of years. It started as a CMMI demonstration project. In your folder, there's an executive summary highlighting the study.
Okay.
Yep.
Thanks, Glenn.
So it's 120, just one more.
Yeah, I saw that, $126 million.
Over what period of time?
1 year.
1 year?
Yeah.
Okay.
Too bad we don't have dynamic scoring, Senator Mayquay.
How about it?
Senator Mayquay, that's on you.
Thank you, Mr. Chair. I just wanted to say, Senator Ebler, I really enjoy your bill, and I was able to sign on as the 5th co-author, and so I appreciate the work that's gone into this and bringing this forward. It's really great, and essentially, I don't think we would need dynamic scoring at a certain point, Mr. Chair. It would just show up. Yeah.
Jim, Josh, what do you want to tell us? I mean,
Yeah, thank you, Mr. Chair and members. I mean, this is something that we know works. We know in other states it works. You have different programs across the country that we have the data. This is not recreating the wheel. And we just need to be able to build the infrastructure here in Minnesota at a fraction of the cost to deliver these services. A lot of the numbers that Mr. Cullen mentioned as well incorporate and account for the services being paid for already. So the numbers that we were talking about are projected savings after services delivered to individuals in the communities by the community-based organizations across this state. So a lot of this money too is a pass-through through Juniper and Trellis to the community-based organizations already providing these services, you know, up in Senator Utke's district and all over the state. And they're doing this because this is their mission. This is their passion. They deserve to capture some of this savings as well, and to be able to expand that reach and to impact more people. I mean, these numbers are real, and we can forecast them out. We can include them, and then that's how we get the attention of the actuaries of the payers in this state, and where we can develop a really true social venture performance-based contracting type of structure that allows for this to expand and grow, not on the dime of the state. And one other thing that I would add is a lot of those savings too that we talk about, especially with the Own Your Future, these services at the Community Care Hub can target those not already on Medicaid. So when we're talking about saving Medicaid recipients like the North Carolina study did, we're also keeping people off of Medicaid, and we're keeping them off the system altogether. So whatever those numbers are, I mean, add that on top of the 126 million projected cost savings, and then we really start to have an impact in future years. And I don't know what else there is to say. It seems too common sense, Mr. Chair.
Absolutely. Senator Abler?
Okay, I'll just close.
Oh, yeah, it's like he gave me a thumbs up. So
Mr. Chair, I have quite a bit to learn about this, but I just, my personal goal in this whole budgeting thing, this is the kind of thing we can do and try to save some money, but if it was up to me, I would establish a $1.2 billion target for this committee over 4 years, 0, -200, -400, -600. Because we do have to find a way, which is $1.2 billion, it creates $1.2 billion in the tails.
Yeah.
And where we shoot for half the reduction, just to, I think we can handle hitting the target, hitting half the deficit, and maybe even more. But just as a legislature, we can just shoot for half of it. I think that's within our capability. Just making up a fiscal note on this, it would be $9.9 million of cost in year one, maybe no savings in two, and maybe $30 million, and maybe, you know, like $60 million or something going forward, and maybe just as a thing. But so to the budget rules, the number that shows up in your spreadsheet, Mr. Chair, 9.9 million.
Yep.
And the 30 and the 60 shows up in November or a year from November,
Yep.
and goes to the bottom line for
Yep.
roads and tax cuts and whatever else. And so
Yep.
if indeed we can find a way to get credible programs like this, that there's evidence of it, and if we can get the industry, all the EBOs and LEBOs and MMB people, legislative budget office, Mr. Chair.
Yeah, I was trying to.
If we can get those to agree that to their best.
You're using TLAs, and it had me to
the
FOSS
best.
for a second. And the TLA is, of course, an acronym for
MYOB,
three-letter
Mr. Chair.
acronym.
So that's a 4. Anyway, but I think it is a time of crisis that's looming, and it's real. We are, the money shortfalls are real. They're coming from our own state, they're coming from the feds.
Yep.
The feds are realizing $36 trillion is a lot of money, and we're borrowing it from people that aren't favorable to our country. And so, at some point, that's a lot. And so I warned people, Mr. Chair, when it was $8 trillion. I said, that's a lot of money. I was wrong. It was not a lot of money. 36 might be. But anyway, if we can have the flexibility with those changes from the feds, with the money we're going to get, and so we don't have to wait for 2 years for CMS to approve something, we can do a lot of things like this with our brilliance and our commitment here.
Sure.
And so this is the beginning of that, and so that's why I'm willing to encourage people that we care a lot, but let's get a chance to get our arms around some of these ideas, and so hopefully this will be one of those. So thank you, Mr.
I
Chair.
appreciate that. So disposition of this?
A layover.
You want to lay it over? All right, Senate File 554, as amended. By the way, members, that Jim's amendment was in our packet. It was just out of order, so I did find it. So, Ati, you have 2 copies of it now. It was well hidden.
So you're looking for the amendment with Senator May Quaid when I made the motion?
Yes, we were all looking for it. So, all right, all those in favor. It's just laid over. I don't need to do anything. Thanks, Jim. Thanks, Josh. Thanks, Mark.